Oke, tes. Oke, tes.
Cek, cek.
program kemahasiswaan yang aktif di berbagai bidang, seperti Mobility Student, Sanggar Tari Ubudia Heritage, Resimen Mahasiswa, UKM Musik, UKM Tarung Derajat, Ubudia FC, iPlus Aceh, unit kegiatan mahasiswa lainnya, seperti UKM Seni dan Tari yang telah berhasil mengharumkan nama UI dalam berbagai ajang dan event internasional. UI tentunya juga memiliki kerjasama mulai dari nasional, regional, dan internasional, seperti MOU Bangkok University, MOU Malaysia, MOU Domsil University, dan kerjasama lainnya. Untuk siswa berprestasi, UI juga membuka kesempatan untuk meraih beasiswa dari Yayasan Ubudia dan jalur bidik misi, serta beasiswa melalui jalur undangan. Regional dan internasional, seperti MOU Bangkok University, MOU Malaysia, MOU Domsil University, dan kerjasama lainnya. Untuk siswa berprestasi,
Assalamualaikum warahmatullah. Jaro 12 ateh jemalah. Tamu beri salem nabikeun sunah. Jaro tamu mat tanda mulia. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahirabbil alamin wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa ashabihi ajmain. Puji syukur kepada Allah Subhanahu wa taala serta salawat kepada Rasulullah sallallahu alaihi wasallam. Yang terhormat Rektor Universitas Indonesia, yang kami hormati Dr. Muhammad Sahezwan, yang kami hormati seluruh dekan, direktur, kaprodi, dosen dan staf Universitas Indonesia, dan tentunya yang teristimewa yang kami hormati seluruh mahasiswa dan hadirin yang berbahagia. Untuk memberkati acara ini, marilah bersama kita simak lantunan ayat suci Al-Quran yang akan dilantunkan oleh Muhammad Naufal.
Assalamualaikum warahmatullahi wabarakatuh. A'udzu billahi minasyaitonir rajim. Bismillahirrahmanirrahim. Idza syamsu kuwirat wa idzan nujumu kadarat wa idzal jibalu suyirat wa idzal 'isyaru untilat wa idzal wuhushu husyirat wa idzal biharu sujjirat wa idzan nufusu zuwijat wa idzal mau'udatu su'ilat bi ayyi dzambin qutilat wa idzas suhufu nusyirat wa idzas samaa'u qushitat wa idzal jahimi su'irat wa idzal jannatu uzlifat alimat nafsum ma ahdarat fala uqsimu bil khunnas al jawaril kunnas wal laili idza as'as was subhi idza tanaffas innahu laqawlu rasulin karim ذي قوة عند ذي العرش مكين مطاع ثم أمين وما صاحبكم بمجنون ولقد رآه بالأفق المبين وما هو على الغيب بضنين وما هو بقول شيطان رجيم فأين تذهبون إن هو إلا ذكر للعالمين لمن شاء منكم أن يستقيم وما تشاءون إلا أن يشاء الله رب العالمين صدق الله العظيم. Assalamualaikum warahmatullahi wabarakatuh.
Menyanyikan lagu kebangsaan Indonesia Raya, hadirin dimohon berdiri.
Indonesia, mengabdi berbakti pada Ibu Pertiwi, memperkasa Dharma pendidikan tinggi, persada Nusantara, wawasan dunia. Universitas Ubudiyah Indonesia membangun generasi, memimpin bangsa menggapai dunia. Inspirasi semua, arif insani berteknologi mulia. Budi setia, bangsa tercinta tujuh ikhlas, mencapai cita murni. UI berinovasi berbudi luhur, kami memimpin Indonesia jaya. Kami memimpin UI, kami memimpin UI.
Hadirin disilakan duduk kembali. Hadirin sekalian, selanjutnya kita saksikan bersama pemutaran video profil Universitas Ubudiyah Indonesia. Universitas Ubudiyah Indonesia menjadi salah satu universitas terbaik di Provinsi Aceh yang memiliki visi untuk menjadi World Class Cyber University di tahun 2025 mendatang. Kecanggihan teknologi dan sarana yang modern menjadikan UI sebagai kampus yang terdepan untuk para generasi penerus bangsa. Universitas Ubudiyah Indonesia telah meraih berbagai penghargaan dan pengakuan nasional maupun internasional. UI meraih prestasi dan penghargaan dari LLDikti Wilayah 13 Aceh di tahun 2022, yaitu sebagai juara 1 kategori perguruan tinggi swasta pelaksana anti korupsi, anti intoleransi, anti perundungan, dan anti kekerasan seksual terbaik. Universitas Ubudiyah Indonesia juga telah mencapai puncak kesuksesan dalam pencapaian ranking EduRank, yaitu peringkat 40 universitas swasta terbaik di Indonesia, dan Unirank di peringkat 4 se-Provinsi Aceh, serta dosen yang memenangkan hibah dikti dan publikasi internasional setiap tahunnya. UI yang memiliki 3 fakultas dan 14 program studi yang semuanya sudah terakreditasi B. Universitas Ubudiyah Indonesia yang selalu mengembangkan sistem pendidikan yang berbasis teknologi untuk semua proses belajar mengajar, pelayanan, dan program untuk mahasiswa yang bertaraf internasional. Terobosan-terobosan terbaru yang dilakukan oleh UI tidak pernah berhenti. UI yang menjadi pelopor dengan menghadirkan stasiun televisi kampus UBONTV yang menjadi stasiun televisi kampus pertama se-Sumatera yang telah banyak mendapatkan penghargaan dari KPI Aceh, salah satunya kategori peduli anak dan perempuan. Program Mobility Student adalah program unggulan di UI yang sudah menjadi agenda tetap tahunan dari Universitas Ubudiyah Indonesia. Program Mobility Student yang bekerja sama dengan perusahaan-perusahaan terkemuka di luar negeri seperti di Malaysia, Singapura, Filipina, dan negara-negara lainnya yang terjalin dalam kerjasama antara Universitas Ubudiyah Indonesia dengan universitas di luar negeri dan juga industri-industri yang berkembang pesat. Universitas Ubudiyah Indonesia yang juga menerapkan sistem belajar e-learning yang sangat mudah diakses oleh para mahasiswa dari berbagai daerah melalui sistem di UI, live streaming, dan melalui program-program khusus di UBONTV. UI juga dilengkapi dengan pusat perpustakaan terakreditasi A yang merupakan perpustakaan swasta yang terakreditasi A di Aceh. Dilengkapi dengan laboratorium dan peralatan yang lengkap untuk semua program studi dan juga UKM-UKM untuk mahasiswa berkarya yang juga sudah banyak menghasilkan prestasi-prestasi di dalam dan di luar negeri. Seperti UKM Ubudiyah Heritage dengan karya seni tarinya yang sudah tampil di berbagai mancanegara seperti Malaysia, Singapura, Hong Kong, Thailand, Filipina, dan Irlandia. UI terus berkomitmen pada kualitas lulusan agar dapat bersaing di pasar dalam dan di luar negeri. Dengan sejumlah kerjasama melalui MOU yang terus ditingkatkan oleh UI dengan universitas di luar negeri termasuk MOU dengan Jinan University China dan Shandong University China. Universitas Ubudiyah Indonesia yang setiap tahunnya mengadakan konferensi internasional, diantaranya IGCMB yang merupakan konferensi internasional yang berkolaborasi dengan Kanada, Irlandia,
Bangladesh, Cina, Bangkok, dan Malaysia. Melalui kerjasama dengan Darfur International University, Eflon Institut Teknologi, University Malaysia Perlis, dan University Utara Malaysia. Kemudian Drug Stage yang merupakan konferensi internasional yang menggabungkan bidang ilmu kesehatan, obat-obatan, dan teknologi serta lingkungan, yang tentunya sukses digelar setiap tahunnya dengan peserta dari berbagai negara yang berpusat di Universitas Ubudiyah Indonesia. Selain itu, UI juga setiap tahunnya menggelar konferensi internasional atau juga ICOSTI, di mana konferensi internasional yang bertajuk International Conference Science and Technology Innovation. Tidak ketinggalan kegiatan Mega Inovasi Internasional I Plus Aceh yang setiap tahunnya digelar di Universitas Ubudiyah Indonesia, yang merupakan ajang pameran inovasi yang menjadi ajang bagi setiap peneliti, baik individu, swasta, institusi pemerintah maupun pendidikan untuk memamerkan hasil karya penelitian di kancah internasional. I Plus Aceh yang menghadirkan dewan juri dari berbagai negara, di mana tim yang dihadirkan merupakan juri berstandar internasional yang telah berpengalaman dalam menyukseskan berbagai exhibition skala internasional. UI juga mengembangkan sayapnya dengan mengembangkan unit bisnis mahasiswa melalui kerjasama dengan perusahaan yang menciptakan produk-produk berkualitas dan berteknologi tinggi, yaitu Destron. Destron yang merupakan perusahaan pabrik perakitan produk yang berteknologi tinggi, diantaranya perangkat box TV, Android yang termasuk channel UBONTV, bersama siaran-siaran lainnya di seluruh dunia, yang dapat diakses melalui TV satelit Destron yang berbasis TV Android dengan sistem streaming TV yang dapat dijangkau di seluruh dunia. Tidak hanya itu, dalam pengembangan unit bisnis UI, di mana UI juga memiliki 1 hotel dan 3 restoran maupun kafe yang bisa dijadikan sebagai tempat praktek ilmu belajar dan terjun langsung di dunia kerja. Sebagai penerima dari 45 award di bidang nasional dan internasional hingga di tahun 2023 dengan misinya yang ingin membawa UI ke level internasional dan menjadikan UI sebagai PTS berakreditasi A pertama di Provinsi Aceh. Dengan kiprahnya selama 19 tahun melakukan terobosan berstandar internasional sejak Universitas Ubudiyah Indonesia masih dengan status sekolah tinggi. Kiprahnya dalam kepemimpinan dipercayakan sebagai Ketua ABP PTSI Wilayah Aceh, Pemimpin Ketua Umum Ikatan Wanita Pembangunan Indonesia atau juga IKAWAPI, yang bergerak di bidang aktivitas sosial untuk membangun Indonesia di bidang pendidikan, kesehatan, ekonomi, dan sosial. Wakil Ketua Umum Organisasi Cinyadin serta penggagas Wanita Tolak Narkoba dengan mengusung program yang terus fokus untuk membangun bangsa baik fisik maupun pembangunan karakter. Di tangan Profesor Ejang Dr. Marniati MKes dan seluruh jajaran akademisi UI yang akan mampu membawa Universitas Ubudiyah Indonesia menjadi PTS terbaik dan dapat dikenal antar bangsa secara global. Universitas Ubudiyah Indonesia siap menyongsong era globalisasi dengan menjadi World Class Cyber University 2025 karena UUI memimpin.
Selanjutnya, kita simak sambutan Ketua Program Studi S1 Farmasi Universitas Ubudiyah Indonesia. Kepada Ibu Rulia Meilina S.Farm MSI, kami silakan.
Assalamualaikum warahmatullahi wabarakatuh. Kurang semangat. Assalamualaikum warahmatullahi wabarakatuh. Nah, ini baru kedengaran ada 200 mahasiswa di aula. Oke, puji dan syukur kita panjatkan kehadiran Allah Subhanahu wa taala yang telah memberikan kita nikmat sehat, nikmat iman sehingga pada siang hari ini kita dapat berkumpul di aula Universitas Ubudiyah Indonesia. Salawat beserta salam tak lupa kita sanjung sajikan ke pangkuan Nabi besar Muhammad sallallahu alaihi wasallam yang telah membawa kita dari alam jahiliyah ke alam Islamiyah yang penuh dengan ilmu pengetahuan, Yang saya hormati Rektor Universitas UBONTV Indonesia, Wakil Rektor, Direktur, Dekan, dan para dosen di lingkungan Fakultas Ilmu Kesehatan Universitas UBONTV Indonesia. Dan yang teristimewa penghormatan kami kepada Bapak Muhammad Sahezwan Abdul Wahab PhD. Terima kasih Bapak untuk hari ini bersedia memberikan materi dan pengetahuan baru kepada mahasiswa-mahasiswa kami di program studi S1 Farmasi. Kegiatan ini sebenarnya sudah lama direncanakan, ya, hampir udah 1 tahun yang lalu direncanakan, dan alhamdulillah hari ini bisa diselenggarakan. Yang teristimewa, yang Ibu sayangi dan yang Ibu banggakan seluruh mahasiswa, mahasiswi di program studi S1 L1 Farmasi, Fakultas Ilmu Pengetahuan, Fakultas Ilmu Kesehatan Universitas UBONTV Indonesia, baik yang hadir di aula maupun yang sudah hadir secara virtual. UI dan Universitas Teknologi Mara Malaysia, khususnya Fakultas Farmasi, sudah menjalin kerjasama sejak tahun 2020 dan sampai saat ini masih berkolaborasi, masih bekerja sama di bidang Tridharma perguruan tinggi, khususnya kolaborasi dosen pengajar, riset, dan pada tahun awal 2023, tepatnya di bulan Maret, kita sudah melaksanakan mobility student, ya, ke Malaysia. Salah satunya instansi atau universitas yang kita kunjungi adalah Universitas Teknologi Mara, ya, khususnya di Fakultas Farmasi. Mungkin sebagian mahasiswa yang hadir di acara seminar ini sudah mengenal, ya, sudah bertemu dan berkenalan dan berinteraksi langsung dengan Bapak Sahezwan, ya, pada saat kunjungan ke UATM. Kemudian besar harapan kami khususnya program studi S1 Farmasi terus melakukan kerjasama program-program yang baru dengan UATM, baik itu dari program riset, ya, mungkin di tahun depan Pak Ewan kita bisa merencanakan kolaborasi kembali dosen dan juga bisa melaksanakan kegiatan pengabdian kepada masyarakat, ya. Apakah nanti Pak Ewan dan mahasiswa UATM bisa berkunjung ke Aceh, ya, ke Universitas UBONTV Indonesia, ataupun kita rencanakan kembali untuk mobility di tahun 2024, mahasiswa dan dosen dari UUI bisa berkunjung dan melaksanakan program yang direncanakan di UATM Malaysia. Kemudian terakhir, apresiasi saya yang sangat mendalam kepada seluruh panitia dan himpunan mahasiswa farmasi yang sudah bekerja keras untuk menyelenggarakan kegiatan ini, sudah mempersiapkan mendadak, ya, Bu Dila, ya, sudah memberikan yang terbaik sehingga seminar hari ini bisa diselenggarakan. Saya ucapkan sekali lagi terima kasih Pak Sahezwan sudah berkenan memberikan ilmu-ilmu pada hari ini kepada mahasiswa kami, dan Ibu berharap kepada seluruh mahasiswa jangan menyia-nyiakan kesempatan ini. Jarang-jarang pemateri kita ini langsung dari Malaysia, ya, gali ilmunya, simak baik-baik apa yang akan disampaikan oleh Bapak Sahezwan, dan apabila ada yang mau ditanyakan nanti bisa menanyakan pada sesi tanya jawab. Mungkin yang ini saja yang bisa saya sampaikan, lebih dan kurang saya mohon maaf. Assalamualaikum warahmatullahi wabarakatuh.
Terima kasih kami ucapkan kepada Ketua Program Studi S1 Farmasi Universitas UBONTV Indonesia, Ibu Rulia Meilina S.Farm MSI. Dan selanjutnya hadirin yang berbahagia, tibalah kita di seminar internasional dengan tema Rules of Pharmacists in Ensuring Safe and Appropriate Use of Herbal and Dietary Supplement bersama dengan Dr. Muhammad Sahezwan PhD. Dan yang tentunya akan dipandu langsung oleh moderator Bapak Armian Nasri ST MMSC. Kepada Bapak kami silakan.
Assalamualaikum warahmatullahi wabarakatuh. Ya, masih semangat ya semuanya ya. Oke, ya karena kita juga masih belum mulai ya. Nah untuk seminarnya, jadi untuk hari ini, seperti disampaikan sama kakak Mas Witia ya. Untuk hari ini kita akan menggelar atau juga bakal mengikuti seminar farmasi dan ini juga merupakan salah satu seminar bisa dibilang internasional ya. Karena kita juga menghadirkan pemateri dari Universitas Teknologi Mara Malaysia atau juga UITM. Nah ada itu Dr. Muhammad Saheswan Abdul Wahab. Dan tentunya juga ini beliau yang sangat expert sekali dalam dunia farmasi dan obat-obatan. Dan tentunya juga tema kita untuk hari ini yaitu Roles of Pharmacists in Ensuring Safe and Appropriate Use of Herbal and Dietary Supplements. Nah jadi untuk sedikit saya memperkenalkan briefly introduction ya tentang profil dari Dr. Saheswan ini ya. Seperti disampaikan sama Ibu Rulia tadi, beliau ini merupakan salah satu scholar yang tentunya juga sangat ahli di bidang farmasi. Nah beliau itu menyelesaikan untuk PhD-nya itu Pharmaceutical Care itu di Chulalongkorn University dan juga untuk Master of Clinical Pharmacy University South Australia di tahun 2010 dan juga mendapatkan gelar Bachelor of Pharmacy di University Teknologi Mara di tahun 2006. Nah jadi ini sangat bagus sekali ya karena juga beliau itu juga untuk research-nya atau juga bidang keahliannya itu di pharmacy practice, pharmaceutical care, pharmacy education, herbal and dietary supplement dan juga geriatric pharmacy. Nah jadi untuk hari ini, itu kita juga akan melihat langsung gitu ya. Jadi kalau di Indonesia kan itu peran para farmasi ya dalam menentukan atau juga memastikan keamanan dan juga kesesuaian dalam penggunaan obat-obat herbal dan juga suplemen untuk diet ya. Nah dan tentunya juga ini tanpa untuk menghemat waktu. Nah langsung aja kita persilahkan Bapak Dr. Saheswan untuk memulai presentasinya untuk juga seminarnya untuk hari ini ya. Dan nanti juga dipersiapkan untuk Q&A-nya 2 atau 3 pertanyaan setelah sesi dari Dr. Heswan memaparkan materinya. Oke, Dr. Heswan, the time is yours now. Thank you. Please. Dr. Heswan, okay, your mic, I think it's from here. So, Dr. Heswan, your volume is maximum. Yeah. Oh, okay. A minute. Our operator will take to make sure about the output of the voice or audio. For our students can clearly hearing and understand about your presentation. Maybe we take 1 minute or hold on. Tes 1 2. Dr. Heswan, you can try to test your voice.
Okay. So, can you hear me?
Okay, yeah, it's
Yes?
really clear now, and we can start.
Okay, thank you
Yeah.
very much.
Yeah.
So, first of all, I would like to thank Professor Dr. Marniati, Director of UUI, um, Pembantu Rektor, Dekan-Dekan, Ketua Program Studi Farmasi, Ibu Rulia. We've been communicating with each other quite regularly. Panitia yang telah menyelenggarakan program ini, juga mahasiswa UUI yang sudi hadir pada hari ini. So, my name is Muhammad Shahizwan Abdul Wahab. I'm a senior pharmacy lecturer at the Faculty of Pharmacy, UITM. And today I'm going to talk about the roles of pharmacists in ensuring safe and appropriate use of herbal and dietary supplements. And I really hope that you could benefit from this talk because there are many people actually who are using herbal and dietary supplements. It is quite common in Malaysia, and I'm very sure that it is common in Indonesia as well. So, this is a picture of my university, UITM. It is located in Puncak Alam. Pak Armian and some of docents have already been there. So I really hope that students from UUI and other lecturers from UUI can visit us one day. And those who have already visited us, you are more than welcome to come again. Okay, so I have a little bit of disclosure. I have no financial disclosure of or conflicts of interest with the presented material in this presentation. So for this talk, these are the aims, the objectives of this talk. So I would like to provide an insight about herbal and dietary supplement use among the public. I would like to expose the students with the key issues regarding herbal and dietary supplement use. And I would like to talk a little bit on the recommendation for us to improve the safe use of herbal and dietary supplements. So before we move forward, I would like to just highlight that herbal and dietary supplements, sometimes it used in different terms in the literature. Some people may call it oral dietary supplements. Some people may call it health supplements. Some people may call it dietary supplements or nutritional health supplements, but they are actually means the same thing. So in Malaysia, the products are normally called as health supplements. And in Malaysia, it is referred to any product used to supplement a diet and to maintain, enhance, improve the health function of a human body. Jadi ianya adalah produk untuk mengekalkan dan juga memperbaiki kesihatan tubuh badan manusia dan ianya boleh dalam bentuk kapsul, tablet, serbuk, cecair, and it is not containing any sterile preparations. So health supplements can be vitamins, minerals, amino acids, fatty acids, enzymes, probiotics, and other bioactive substances. And sometimes it can also include products, natural products, including animals, minerals, botanical materials, seperti ubatan-ubatan herba, in the forms of extract, isolate, concentrate, and metabolite. So this is the definition used in Malaysia. And I'm sure that in Indonesia, there would be a specific definition to refer to herbal and dietary supplements. And this is the definition that has been used in the United States. And you can see here that the definition is quite similar to the one that we use in Malaysia. So in the United States, herbal and dietary supplements are also include vitamins, minerals, herbs, and other botanicals, amino acids, and dietary substances. And when we talk about dietary substances, it refers to products such as enzymes that are commonly referred to as probiotics, concentrates, metabolites, constituents, and extracts. So these are can be commonly found to be sold at a community pharmacy, for example, as dietary supplements. So another term that I would like to introduce to you is the complementary and alternative medicine, or CAM. And these definitions are also used interchangeably to other terms. Jadi terma ini kadang-kala digunakan dengan terma-terma yang lain seperti ubatan tradisional, traditional and complementary medicine, traditional complementary and integrative medicine, but it actually refers to the same treatment modality. And when we talk about complementary and alternative medicine, we are actually talking about various practices, and these include manipulative body-based therapy. We have mind-body interventions such as yoga, spirituality, and relaxation. We have alternative medical systems such as homeopathy, naturopathy, and Ayurveda. We have energy therapies as well, such as Reiki, magnets, and Qigong. And finally, we have what we call as biologically based approaches. So this is where our herbal and dietary supplements are categorized in complementary and alternative medicine. So we can say that herbal and dietary supplements are part of complementary and alternative medicine. All right. So the next question that we have is, are the use of these products, herbal and dietary supplements, common? So we have several data in Malaysia. For example, in one survey, kajian tinjauan ya di Malaysia melibatkan 3,000 respondents. So in this study, it showed that about 30% of the participants use vitamins and minerals as well as food supplements that contain herbal products. And then there is another study involving a higher number of participants. You can see here it is almost 100,000 participants, right, in this survey. And in this survey, they found out that almost about 50% of the respondents use complementary and alternative medicine. So in Malaysia, the use of these products is very common. So what about in Indonesia? So I have some opportunities to look up the data, and you can see here that the use of these products are high in Indonesia. For example, in this study, it was shown that 63% of participants were using dietary supplements in Yogyakarta. And in this study, the finding was even higher. 77.63% of respondents consumed dietary supplements during the post-Delta wave of the COVID-19 pandemic. And the majority of them are using vitamin, minerals, protein, and other natural products. And in another study, the use of dietary supplements, herbal and dietary supplements, was common as well. What's interesting about this study was that the respondents in this study were divided into two groups based on their health status. So the researchers divided them into two groups. One is the vulnerable population. So So these are the participants with comorbid diseases such as metabolic syndromes, obesity, hypertension, diabetes mellitus, and another group that are considered non-vulnerable. And what they found out was there was a significant difference between the two groups concerning the consumption of supplements. So they found out that the vulnerable population, those who have diseases, those who are present with diabetes, hypertension, those who are elderly, are more likely to consume supplements than those that are defined as non-vulnerable. And we can see here the common types of the herbal and dietary supplements that the participants use. And these include vitamin C, vitamin D, multivitamin, herbs, and honey. So, who normally use herbal and dietary supplements? So it is very hard to answer this question because different study would produce different results. But generally, we can see from the literature that women, older people, those who have higher educational level, and those who have higher income are more likely to use herbal and dietary supplements. And people who have chronic diseases are also more associated with the use of herbal and dietary supplements. So, for example, in Malaysia, we have several data. In this study, the first study, 44.5% and 24.9% of chronic disease patients use vitamin and herbal medicine to manage diseases such as diabetes mellitus, peripheral neuropathy, and dyslipidemia. And in another study, herbal and dietary supplements are very commonly used in patients with cancer, hypercholesterolemia, hypertension, and diabetes. And I'm sure that these trends are similar in Indonesia setting as well. And who else are commonly using herbal and dietary supplements? So studies have already also shown that the use of herbal and dietary supplements are also prevalent or commonly used by older people, pregnant women, and breastfeeding mother. So we need to be concerned because we know that older people might have different physiologically function that could make the metabolism of herbal and dietary supplements not as efficient as in younger adults. So there are a lot of reasons why people use herbal and dietary supplements. First and foremost, because it is very easily obtained. So we can go to the community pharmacy, right? In Indonesia, for example, we can go to apotheker, and we can walk in the shop, and then we can grab a product. We go to the counter and pay. So there is no prescription involved, and therefore it is very easily obtained. Sometimes we can obtain these products from grocery shops, healthcare shops. We can get those products from self-care product shops. So it is very easy to be obtained. And some people want to use herbal and dietary supplements to improve their emotional well-being, to improve their health, to maintain their health, to prevent illness, and to treat diseases. And sometimes it is due to the influence of media. And we can see nowadays there are a lot of influencers, there are a lot of celebrities who are promoting herbal and dietary supplements in social media. And for some people, they use herbal and dietary supplements due to the influence from other people, especially their friends and family. So if people who are close to them use the products, they are more likely to use those products. For some people, they want to complement existing therapy, meaning they are already on certain types of medications. They are already being prescribed with prescription medications, and they would like to have better result, for example. So they use herbal and dietary supplements in complementary to the prescribed medication. And for some people, they may think that herbal and dietary supplements as natural, safe, and less side effects. So there are actually many people who have this thought about herbal and dietary supplements. And for some people, they believe in holistic medicine, so they want to use herbal and dietary supplements um, to manage their diseases or medical condition. However, um, we need to remember that herbal and dietary supplements also have some risks if they are not being used appropriately. So some of the issues with the use of herbal and dietary supplements are adverse effects. This is because herbal and dietary supplements also contain chemical moiety that can exert pharmacological action in human body, and these can result in adverse effects. And herbal and dietary supplements can also interact with conventional medications or with prescribed medications. And for some people, it can impair their adherence to their prescribed medications. This happen when patients are using prescribed medications, but they stop using the prescribed medication to use herbal and dietary supplements. So this is when this happens, we can say that their adherence to the prescribed medication are impaired. And for some people, they may not want to try, or they may not want to see the doctors to manage their diseases, but they want to try herbal and dietary supplements first. So in this case, they may delay evidence-based conventional care that may be more beneficial to them and may be more proven to as treatment for their diseases. So there have been a lot of studies that showed the adverse events related to dietary supplements. So this is one of the studies. So this study showed that more than 7,500 emergency department visits in the United States are estimated due to herbal and dietary supplement adverse reaction. And you can see here the majority were due to adverse reaction, and there are some cases that due to the use of excessive dose of these herbal and dietary supplements. So we need to be aware that these products could also cause adverse reaction or side effects that could lead to the patients being admitted into the emergency, into the hospital. And in the study that I mentioned earlier, the visits were mainly due to cardiovascular symptoms or mild to moderate allergic reaction. And you can see here that the adverse effects were mainly were mainly from herbal medicine, and then from dietary supplements, and a minority from the use of multiple dietary supplement products. And I'm not sure if this product is popular in Indonesia, but I found it in Indonesian Shopee. So this product is black cohosh, and it is mainly used to manage women. It is mainly promoted as a product to maintain women's health. And I also found that this product is available in Indonesia as well. And this is noni or jus buah mengkudu. Okay. The product that I mentioned to you just now actually can cause liver injury. For example, black cohosh has been associated with elevated liver test and liver failure. And green tea extract, another common herb, also can cause acute hepatitis, hepatocellular injury, and noni juice, juice mengkudu that I showed earlier, also can cause acute hepatitis and liver failure. And the use of herbal medicine, especially, have been associated with nephrotoxicity as well. Some herbal medicine can cause direct nephrotoxicity, nephrolithiasis, rhabdomyolysis, and especially those that are adulterated can cause harm to the body as body and the kidney as well. And there are several herbal and dietary supplement products that have been associated with severe adverse effects. You can see here even common products such as propolis have been associated with acute renal failure. And I've also found that this product, propolis, can may be common in Indonesia. I'm not sure. You can update me on this. So on top of adverse effect of herbal and dietary supplements, you can see here that there are many drug interactions involving herbal and dietary supplements and medication. For example, vitamin A, when it is used with drugs called as retinoids, it can increase the risk of toxicity of retinoids. Pyridoxine can interact with drugs such as levodopa and phenytoin. And this interaction can decrease the efficacy of levodopa. And when it is used with phenytoin, it can increase the risk of seizure. And vitamin E, which is quite a common vitamin used among the public, can interact with warfarin and therefore can increase the risk of bleeding. So there are a lot of interactions between vitamins and minerals with medication. So we as a pharmacist need to be aware of these interactions. And if our patients are using a vitamin or minerals, we may want to check what are the medications that the patients are using. And we want to check if there are any interactions between the vitamins or minerals with the medications that the patient is taking. Not only vitamins and minerals, herbal medications can also interact with prescribed medications. For example, here, black cohosh, the product that I shared with you just now, it can reduce the effectiveness of statins. Ginkgo, which is another popular dietary supplement, can increase bleeding risk with warfarin. And ginseng can also reduce international normalized ratio and can reduce blood glucose level. And drugs such as St. John's wort, so this drug is quite popular as well in Malaysia, and it is used normally to improve the mood of a person. It can interact with multiple medication and can reduce the effectiveness of many drugs. So we need to be aware that herbal medicine can interact with conventional medication. So we need to be vigilant of this and make sure that our patients are not using products that could interact with the medications that they are using. So what about overdose? Do you think that it is common for people to have overdose of herbal and dietary supplements? The answer is yes, um, as as what I have shared earlier in the study that showed emergency department visits due to herbal and dietary supplements, you can see here that more than 2,000 emergency department visits are estimated due to the use of excessive dose of herbal and dietary supplements. And I would like to share with you a case that I have encountered before myself. So you can see here, the patients are using this product. So this product is called Royal Maca for Male. And you can see here that this product, uh, that you can see here that two capsules of the product contain 12 milligram of zinc. And if you read the instruction here, the consumers are instructed to take 2 to 6 capsules daily. And these user are taking 6 capsules every day. So 6 capsules is equal to 36 milligram of zinc. And on top of that, the consumer also takes this supplement which contain 30 milligram of zinc. So in total, the consumer or the patient is already taking 66 milligram zinc every day. So when we look at the recommended a daily intake of zinc for male, it is only 40 milligram per day. So the patient or consumer is already taking more than he should. And we should be aware that excessive dose of zinc could cause multiple medical conditions such as nausea, vomiting, diarrhea, epigastric pain, abdominal cramps, copper deficiency, anemia. So we always need to ask our patients how they are using their herbal and dietary supplements. And we want to assess whether they are using those herbal and dietary supplements appropriately. And this is from a news clipping that I found from the internet. It says that this man started losing feelings in his legs after taking too many high dose B vitamins, and the person eventually loses his ability to walk. So this is another example, another case that showed the harmful effect of excessive dose of herbal and dietary supplements. And I would like to also share research findings from one of our research projects. So basically, in this research, we investigate the use of herbal and dietary supplements among older people or elderly in Puncak Alam, Malaysia, where we are located in Malaysia. So in this study, we found out that about 50% of the participants use at least one type of herbal and dietary supplements. And some of the reasons are easy to obtain, it is affordable, it is recommended by their family and friends. They wanted to try herbal and dietary supplements, and they think that the products are effective. So we also found out that hypertensive individuals are more likely to use herbal and dietary supplements. And we also found out that many of the herbal and dietary supplements users are also using at least one type of medication. So we have concern there, right? So first, it is being used by people who have chronic disease, And secondly, it is being used by those who are using conventional medication. So we are concerned about herbal and dietary supplements and medication interactions. So if you look at the clinical practice guidelines, the recommendation here says traditional medicines are not recommended for the treatment of hypertension. So we need to be aware of this, and we want, if our patients are using herbal and dietary supplements to treat um, a specific disease, and if there is no evidence behind it, we may want to talk to our patients and advise them accordingly. So these are some common types of herbal and dietary supplements used by the respondents in the study. Vitamin C, honey, fish oil, glucosamine, including jamu as well, and vitamin B complex. And most of them use it to maintain health. About 40% would like to prevent disease from the use of the product. About 25% would like to treat minor illnesses, and a minority would like to treat chronic diseases from the products. So this is interesting. In the study, we actually asked them what did they claim they used the product for. So these are some of the findings that we got from the study. So the respondents said they used vitamin C for fever, cold and flu, skin itchiness, constipation, cough, and to treat migraine. So, but actually, there are no evidence that proves or showed that vitamin C are beneficial for these medical conditions. Okay, there can be no evidence, or there are little evidence that can back that claim. Yeah. And then another example is the respondents said they use honey to prevent diabetes mellitus, hypertension, cold and flu, cancer, cough, fever, and stroke. So again, although we know that honey is nutritious, vitamin C is good for health, but there is little evidence that these products can treat chronic diseases or can prevent chronic diseases. So that's interesting. So that means that the older people or the respondents in our study may have been misled, or they may have misconceptions about herbal and dietary supplements. So we asked further the participants, where did they got all this information about herbal and dietary supplements? So the majority of them said they got the information from their family and friends, from the internet, from the television. So now we know the answers why they have these misconceptions about um, herbal and dietary supplements, because we know that those information sources are not reliable. They can be just testimonial, and they can just be marketing information. And we also asked the participants whether they disclose, meaning that whether they tell their healthcare professionals, such as the doctors or pharmacists, about their use of herbal and dietary supplements. You can see here that the majority of them um, did not discuss or tell their healthcare professionals about their use of herbal and dietary supplements. Yeah. So this is a concern, because if they do not tell their healthcare professionals or pharmacists, the healthcare professionals could not assess the appropriateness of the product. So they could not assess whether there is interactions between the products and the medications that they are using, or they cannot assess whether the medications are safe to be used for the patient. So, talking about social media, right? We can see that it is so easy to look for supplements or dietary supplements in this platform. You can just type supplement, and there are a lot of products pop out from our social media. You can even just type in supplement and the diseases, and you can see here the suggestions of a variety type of herbal and dietary supplements to treat diseases. And this is the results that I got after typing supplement and hypertension. There are a lot of suggestions by the internet. And the online shopping platform are also abundant with this product as well. You can easily type in a specific type of product, and you can easily find it and purchase it. So I've been talking about the risk of herbal and dietary supplements. So the question is, can we as pharmacists recommend herbal and dietary supplements to our patients or customers? So the answer is yes. So although I have mentioned that there is little evidence about the effectiveness of herbal and dietary supplements to treat certain chronic diseases, there are enough evidence that support the use of herbal and dietary supplements in certain situations. For example, it is recommended to provide calcium supplementation to women who are pregnant, who are in their early pregnancy, to avoid or prevent preeclampsia. So this is a recommendation. And for the management of dyslipidemia, fish oil can be beneficial for patients with high cholesterol or TG. Dietary fiber can be beneficial for patients. Plant cereals and stanols can be beneficial. So these are the types of herbal and dietary supplements that we can recommend to our patients. And on top of that, there are multiple herbal medicines that are potentially useful for COVID-19. And these medications are being tested for their effectiveness. And there are also a lot of other herbal dietary supplements such as zinc, vitamin D, vitamin C, curcumin, kunyit, probiotics, and also quercetin that are being currently studied for their effectiveness to be used to treat COVID-19. But the results are still not out yet. So we are hoping that the studies could produce good results regarding the use of those products to treat COVID-19. And we can also use vitamin D and calcium, and we should recommend vitamin D and calcium to older patients with a history of multiple faults. And another good candidate of herbal and dietary supplements are the obese patients. So we can see here that people who are obese are generally deficient in vitamin C, vitamin D, vitamin A, vitamin E, zinc, and other types of vitamins as well. So this group of people can be good candidates or can be good type of consumers that you may want to recommend the products to. Okay, so if you would like to know more about the roles of pharmacists, you can visit this statement on the use of dietary supplements. It actually tells what pharmacists should do in terms in related to dietary supplements. Another good reference about the roles of pharmacists relating to herbal and dietary supplements is the ACCP white paper on herbal products. So if you have the time, I would recommend you to find this paper and read through this paper. So, but here I would like to summarize a little bit on the roles of pharmacists to ensure safe and quality use of herbal medicine. So the first one is we need to have a continuing and open dialogue with patients about the use of herbal and dietary supplements. Remember the research project that I shared earlier? The majority of them did not disclose or tell the healthcare providers or pharmacists about the use of herbal and dietary supplements. So patients actually they have this behavior. If we don't ask them, they won't tell you. So we need to ask them what they are using. If we don't ask, they won't tell. And pharmacists in general, actually, they also have this behavior. If patients do not ask, they would not provide advice. So this is not good. Actually, we need to advise all of our patients. So what can be done by pharmacists? We can recommend herbal and dietary supplements. Remember that there are instances, there are conditions, there are scenarios in which herbal and dietary supplements are good for our patient. We can change herbal and dietary supplements, meaning that if we see that the products are not suitable for our patients, if it is interacting with the medications that they are using, we can propose a change of herbal and dietary supplements. We can alter the dose if we see that they are using higher than the recommended dose. We can discontinue herbal and dietary supplements if they are using inappropriate products. We can provide patient-specific education, and we can also refer them to specialists. Also, okay, and it is important for pharmacists to use current resources because data from in vitro and human herb-drug interactions are being published regularly. And nowadays we have so many data about herbal and dietary supplement interaction with medication. So we need to be aware of this data, and we need to be vigilant and keep ourselves up to date. And if your patient is taking prescription and you cannot find any information about the interaction with the medication, it is recommended for you to advise not taking the herbal and dietary supplements. So the conservative approach is to recommend against the supplement use. And here I also list out several good resources to know about good resources on dietary supplements and drug interactions. So you can use any of these resources to learn about dietary supplement and drug interactions. And I also recommend that you should not fear opening a book or package insert in front of a patient in order to guide them accordingly. This is because the products are many, right? There are so many herbal and dietary supplements, and it is impossible. Even myself, I do not know all of them. So we should not be we should not be afraid of opening the package insert in front of a patient to guide them accordingly. And we should give priority to patients who are on drugs which have narrow therapeutic index, such as warfarin, older people who are at risk of polypharmacy, renal, who have renal and hepatic impairment. Those are the patients that we need to be pay attention more if they are using herbal and dietary supplements. And remember, if for the patient, if you do not ask them, they would not tell you. And for pharmacists, if patients do not ask, they won't advise. So we do not want this to happen. Yeah. So we need to be more proactive to ask our patients what sort of herbal and dietary supplements that they are using. So we also have conducted a study about because we are wondering why people are not consulting pharmacists about herbal and dietary supplements. And you can see here that about 40% to 50% of the respondents never thought of consulting pharmacists regarding their use of herbal and dietary supplements. For some people, they do not have time. For some people, they think they can make their own decision. And here you can see that the participants said that the pharmacist did not ask them about the use of herbal and dietary supplements. And there are also some people who think that there is no need to consult the pharmacist because the products are safe. So you can see here the participants or the public have a specific, for some of them, they have these specific thoughts about pharmacists and herbal and dietary supplements. So we need to show to the consumers, the public, that we are the people that people can refer to, that people can consult about herbal and dietary supplements. And for that to be a reality, we need to be proactive. We need to always ask our patients about the use of herbal and dietary supplements. And in this study, you can see here that about 50% of them think that they can make their own decision without the help of pharmacists. But when we ask them where did they got information about herbal and dietary supplements, similar to the earlier study that I shared, most of them actually refer to the internet, social media, family members. All of these information sources are not reliable. So, as a final word, we can say that herbal and dietary supplements is prevalently used among the public and the patients. So I'm sure it is commonly used in Malaysia. I'm sure it is commonly used in Indonesia and many other parts of the world. And we need to be aware that there are several issues regarding herbal and dietary supplements. So we need to be aware that it can cause adverse effects, it can interact with medications, it can it can impair adherence of our patients, and it can delay evidence-based treatment among our patients. But we should be aware that some herbal and dietary supplements can be beneficial to our patients. And we need to remember that pharmacists have important roles in improving the safe use of herbal and dietary supplements. Remember that that we can be more proactive, we can be more active in ensuring the safe and quality use of herbal and dietary supplements. And with that, I would like to thank you for your attention. That is all for my presentation. I would, if you have any questions, I am more than happy to answer them. Thank you.
Okay, thank you very much, Dr. Muhammad Saheswan Abdul Wahab. Also give applause to Dr. Saheswan yang pastinya juga sudah menjelaskan ya kepada kita itu bagaimana tentang the benefits atau juga side effects ya tentang HDIS ya, Herbal and Dietary Supplements, dan bagaimana seharusnya untuk dikonsumsi dalam terus juga dalam situasi seperti apa, kadarnya ya, dan juga potensinya gitu untuk untuk kita sebagai untuk adik-adik ya yang pasti juga ya bergerak dalam dunia farmasi. Oke, now kita juga masuk ke dalam sesi tanya jawab. Nah, mungkin 2 pertanyaan ya mewakili ya. Nah, mungkin maksimal 3. Nah, jadi mungkin for the first question. Oh ya, oke, ada Diva nih, silakan. Berarti berdiri sini aja kali ya. Nah, sini aja Diva, oke. Oke.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Perkenalkan, nama saya Diva Prilidia Sauli dari Prodi Farmasi Letting 2020. Pertanyaan saya, bagaimana memastikan bahwa suplemen herbal yang dipilih telah lolos uji keamanan dan kualitasnya? Dan apakah suplemen herbal aman dikonsumsi pada pasien yang memiliki penyakit kronis? Terima kasih.
Oke, tepuk tangan untuk pertanyaan dari Diva ya. Nah, jadi itu ada dua tadi, bagaimana kita bisa memilih ya. Dan kita sudah mengetahui itu melewati proses standar dan juga kontrolnya, dan juga bagaimana apakah itu bisa diberikan side effect-nya ya kepada para pasien yang punya penyakit kronis. Oke, mungkin bisa dijawab langsung ya.
Ya, boleh, bisa.
Okay, boleh.
So first and foremost, to make sure that the product is good for your patients, the first one you need to ensure that the products are being produced by a reputable manufacturer. So that is the first one. I'm sure in Indonesia, you have your own regulation in terms of the manufacturing of the products. Okay, so that's the first one. Make sure that the products are produced by reputable and reliable manufacturers. And it has its registration and all of those according to your country's regulation. All right. The second one, although it is produced by reliable manufacturers, it has been registered. You need to make sure that the products are being used appropriately. So this is when your roles come in as a pharmacist. So you need to advise the dosage, the correct dosage for your patient. You need to check whether there is interactions between the use between the products and the medications that your patients are using. So if all of those are fine, if there is no issues, no interactions, it is suitable for your patients. For me, I think it is you can use those products safely for your chronic patients. Dan for the second question, apa ya Pak?
Apakah suplemen herbal ini dapat dikonsumsi oleh pasien yang memiliki penyakit kronis?
Oh, I see. Yeah, it depends on the product. Ada produk supplement yang boleh dikonsumsi, that can be consumed by chronic disease patient. There are products that are not suitable for them. So we as pharmacists, we need to always check. Kita sebagai pharmacists, we need to check regularly. Check with the literature, check with the current evidence that we have, and hopefully by this means, by this method, we can ensure that the products are being used safely by our patients.
Thank you very much. I give big applause for the answer. Ya, tepuk tangan ya untuk pertanyaan dan juga jawabannya. Maybe one more question. Oke. Ya mungkin langsung datang ke sini aja. Biar terdisplay ya untuk wajahnya, dan tentunya juga bisa didengarkan langsung sama Prof. Saheswan ya untuk pertanyaannya.
Assalamualaikum warahmatullahi wabarakatuh. Saya ingin bertanya tentang praktik masyarakat Indonesia yang ada di kampung-kampung. Jadi kan mereka itu menggunakan bahan suplemen herbal itu dengan campuran obat-obatan yang sudah diregulasi. Jadi kan mereka mencampurkannya dengan suplemen herbal itu dan menimbulkan efek placebo. Jadi bagaimana caranya kita bisa memastikan bahwa obat ini bagus atau obat ini bagus atau aman kayak gitu untuk dikonsumsi, karena dengan alasan ini kan dari herbal suplemen kayak gitu. Terima kasih.
Oke, tepuk tangan, very good question. Nah, mungkin langsung bisa dijawab sama.
Yeah, that's a very good question. Because bila patient menggunakan ubatan herba, mereka fikir ubatan herba itu adalah selamat dan alami. They think that they are safe and because they are natural. But we need to remember that these herbal medications, these herbal products also contain chemical moieties. It also contains chemicals that can exert the pharmacological action, right? So these pharmacological actions can give rise to the adverse effect if the dose are being used inappropriately. Okay, so di Indonesia mungkin banyak ubatan-ubatan herba yang digunakan dan kita tidak tahu sama ada ada interaksi ataupun tidak, sama ada ianya sesuai ataupun tidak. Jadi sebenarnya, in my opinion, we need to do more studies about this herbal medicine. What we have in the literature are mainly those products that are popular in Western culture. You know, like St. John's wort, black cohosh, ginkgo. Those herbal medications are quite common in Western culture, but we have less information regarding herbal and drug interactions for ubatan herba yang digunakan oleh orang-orang kampung di Malaysia, di Indonesia. So we need to have more studies. Perlunya ada penyelidikan, uji kaji mengenai interaksi antara ubatan herba dan ubatan tersebut.
Oke, I think that's all untuk pertanyaannya ya, untuk sesi pertanyaannya, karena tadi juga sudah mewakili 3 pertanyaan ya, ada 2 dari Diva dan juga ada 1 pertanyaan terakhir yang sangat bagus sekali, yang tentunya juga ini yang mungkin relate dengan tema kita untuk hari ini ya. Bagaimana peran dari seorang farmasis untuk memastikan kalau kombinasi antara herbal, apa sih tadi? Ya, herbal and dietary supplements ya. Oke, untuk menghemat waktu, nah kita juga masuk sebelum saya juga akan take over atau juga hand over untuk MC, untuk Mas Fitia. Nah ini kita juga mohon untuk kita buat foto bersama ya. Ya mungkin untuk semuanya udah bisa langsung untuk join, itu di link Google Meet-nya dan kameranya dibuka supaya juga kita bisa di screenshot ya untuk kita ambil foto bersama. Nyalakan kameranya semuanya, saya kasih aba-aba, ini yang screenshotnya mungkin dari, ya. Oh, oke. Ya itu masih banyak yang masih belum membuka ininya ya, kameranya ya. Ya, mungkin yang belum join ya, mungkin yang di plenary hall, sekarang lagi di UI. Nah sebelum kita menutup acaranya, kita masuk untuk foto bersama dulu. Wow banyak ya, ayo semua kameranya dinyalakan. Nah dan juga ini acara kita juga disiarkan secara langsung, secara live di UBONTV. Oke, udah semua ya? Oke, kita swing ya. Kita ini berapa menit ya? Saya hitung apa-apa 1, 2, 3 ya. Mic-nya di mute. Ini apa tanda mic di HP kalian itu di mute dulu ya. Oke, siap-siap ya. Kita berfoto bersama untuk bersama dengan pemateri kita, Dr. Muhammad Saheswan Abdul Wahab. Nah, ada juga untuk para semua sudah siap ya. 1, bentar, tunggu dulu. Oke, saya hitung aba-aba. 1 sampai 3 ya. 1, 2, 3. Cheers. Oke, senyum semua. Udah? Dapat ya? Oke, terima kasih untuk kesediaannya. Kita juga sudah melakukan momen foto bersama. Baiklah, untuk selanjutnya kita juga mengucapkan terima kasih banyak ini untuk Dr. Muhammad Saheswan Abdul Wahab dengan materinya yang sangat luar biasa sekali ya. Ini tidak hanya ini berguna untuk adik-adik para pharmacy student and also for our audience UBONTV as well. Oke, saya dari moderator untuk sesi seminarnya selesai. Nah, saya kembalikan kepada MC kita Mas Pitia. Silakan, Tia. Terima kasih.
Terima kasih.
Selanjutnya dilanjutkan dengan penyerahan sertifikat secara online.
Oke, mungkin Profesor bisa dinyalakan kameranya karena kita akan menyerahkan sertifikat secara online. Nah, jadi kita mungkin foto bersama dulu ya. Oke, mungkin bisa di-capture. Saya mewakili dari Ibu Rulia sebagai Kaprodi dari S1 Ilmu Farmasi dan juga dari Rektor Universitas Budaya Indonesia dari pihak UI menyerahkan sertifikat untuk Prof. S1. Oke, sudah ya, sudah di-capture ya? Oke, ya baik, next.
Selanjutnya pembacaan doa oleh Muhammad Naufal.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين حمدا يوافي نعمه ويكافئ مزيده يا ربنا لك الحمد كما ينبغي لجلال وجهك الكريم وعظيم سلطانك اللهم صل على سيدنا محمد وعلى آله وصحبه أجمعين اللهم أحسن عاقبتنا في الأمور كلها وأجرنا من خزي الدنيا وعذاب الآخرة اللهم إنا نسألك رضاك والجنة ونعوذ بك من سخطك والنار اللهم اغفر لنا ذنوبنا ولوالدينا ولمشايخنا ولجميع المسلمين والمسلمات والمؤمنين والمؤمنات الأحياء منه والأموات برحمتك يا أرحم الراحمين اللهم إنا نسألك من سلامة في الدين وعافية في الجسد وزية في علمي وبركة في الرزق وتوبة قبل الموت ورحمة عند الموت ومغفرة بعد الموت اللهم انصر إخواننا المسلمين والمجاهدين في فلسطين اللهم انصر إخواننا المسلمين والمجاهدين في فلسطين اللهم انصر إخواننا المسلمين والمجاهدين في فلسطين اللهم فعنا الخلاء والبلاء والوباء والفحشاء والطاعون والمنكر والسيوف المختلفة والشدائد والمهان ما ظهر منها وما بطن ومن بلدان المسلمين عامة إنك على كل شيء قدير ربنا لا تزغ قلوبنا بعد إذ هديتنا وهب لنا من لدنك رحمة إنك أنت الوهاب ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. Assalamualaikum warahmatullahi wabarakatuh.
Dengan mengucapkan Alhamdulillahirabbil alamin, maka berakhirlah acara seminar internasional dengan tema Roles of Pharmacists in Ensuring Safe and Appropriate Use of Herbal and Dietary Supplement pada Senin 18 Desember tahun 2023. Saya selaku MC mohon undur diri. Wassalamualaikum warahmatullahi wabarakatuh.
Mahasiswa jangan keluar dulu, cinta. Foto dulu bersama Ananda. Astagfirullahaladzim, Robi.